Do you know how thyroid surgery is actually performed inside hospital's operation theatre? If not, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. By the way, our today's video is a part of our series of the videos on a thyroid surgery. Previous to that, we have spoken about what is thyroid surgery, what are the types of the surgery, who all are the candidate for the surgery, what are the complications can happen, what can you do so that your scar does not leave a permanent scar, what kind of a rehabilitation exercise you can do for a better and a speedy recovery. If you have not watched those videos, then I'll advise you to watch those videos so that you get a complete detailed information. Especially this series is very important for those people who have been advised to undergo a thyroid surgery or who have any kind of a goiter or a thyroid cancer where a thyroid surgery can be a considered part of the treatment. Alright. Now, before I continue this video, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है और अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's begin our today's topic, that how actually the surgery is performed inside the hospital operation theatre and what can you expect during your stay inside the hospital. So first and foremost is going to be the pre-operative evaluation, that is nothing but an evaluation before the surgery. So see, if you notice any kind of a discomfort in your neck area, whether any kind of a lump or a nodule or a swelling, you are going to visit to either of the two doctor department. Either you will reach to an endocrine department or you will visit an ENT doctor's department. And now this doctor will do your thorough neck examination. Your doctor might ask you to do few blood tests pertaining to a thyroid. You might be advised to do few testing like a ultrasound or sonography of your neck and a thyroid area. If there is a single lump, then your doctor might ask you to do one more advanced test called as a fine needle aspiration cytology or a FNAC, wherein we are going to obtain a small amount of a liquid from the gland and the swelling, and this will go into a further microscopic examination to find out that what kind of a swelling you have. Sometimes if your doctor suspects that your goiter or enlargement is very large, you might be even advised to undergo a CT scan to find out that do you have any kind of a excess of a growth which is going behind your chest area, that is a retrosternal goiter. So these are the few testing which you might have to undergo. And after obtaining the results of all these tests, cumulative results will take a decision whether you are a candidate for the surgery or not. And if at all you are supposed to undergo a thyroid surgery, you will be referred to the another department doctor. You might be referred to either an endocrine surgeon. If there is any kind of a cancer which has come up, then you might have to visit to an oncology department and oncological surgeon also. They are going to give you a confirmed date of your operation when you should be actually undergoing the surgery. Now, so once your date for the surgery is decided, during this process, you will also have to do few more evaluation. Okay, you might have to do your complete blood examination. They might ask you to check your blood sugars, whether you have a diabetes or not. Your blood grouping will be tested, then your bleeding time, then the clotting time. These are again very important after the surgical recovery. Alright. Now, if you are a 65 or 70 years plus individual, or if you have any kind of a heart problem, then in that case your doctor might also send you to a cardiologist, and the cardiological medical fitness also has to be obtained. And if you have a diabetes, and especially if your diabetes is not in control, you might have to go to endocrine department or a diabetologist doctors who will manage your blood sugar so that you can undergo the surgery, and recovery from the surgery is faster and without any complications. You might also have to visit to an anesthetist, and the anesthetic fitness has to be also obtained. You might have to undergo a testing like an electrocardiogram or a ECG. So these are couple of testing which are mandatory before you undergo a surgery. Your doctor also might ask you to do some vocal cord function testing so that we can evaluate that after the surgery, do you have any higher risk of a voice changes or not. And most of the time before we actually take you for the surgery, we also want that your thyroid hormones are in the optimum range so that you are in the euthyroid state and not in a hyperthyroid. What happens if your thyroid blood tests are not accurate? Then you have a chances of undergoing a thyroid storm, which can be a very severe and a major complication. To avoid that, many of the times if the surgery is elective and it is a planned surgery, we want you to have a euthyroid state. Alright, so this is all about the preoperative evaluation. Now you have given a particular date for the surgery, and now when you are ready to go for the surgery, what all things you need to keep in mind. Alright. So first of all, when the surgical date is given, a few days prior to that, few of the medications may be modified. In this, a very important medicines are like a aspirin or a warfarin or heparin. So if you are taking such medications, your doctor might modify the medicines. You are advised to continue your other medications like that of your blood pressure. And if you have a diabetes, again your medications might be modified. You might be put up on an insulin, and along with that the tablets for the diabetes management. Okay. Now when you actually go for the surgery, prior to that you are not supposed to be eating anything after the midnight. That means nil by mouth is usually advised. So if you have a diabetes, please speak to your doctor so that you do not land up into hypoglycemic event wherein your sugars will go low and you might have to eat something urgently. And in that kind of a situation, your surgery might be postponed or might be delayed. So please speak about this with your diabetes specialist doctor. Now when you are about to reach to the hospital, make sure that you carry your medical file. Again, a very important general practical point, people forget the file at home. So don't do that. Carry all your medications, carry all your other medicines and the doctor's prescription which your doctor has advised. Okay. When you go to the hospital, make sure that you wear a loose clothes and you take a bath, especially head bath. What happens after the surgery for few days, though there are not very severe restrictions, but of course we advise to not to take a head bath and all, at least for few days. So if you have a long hair and all, then you should take a head bath. And if you are a gentleman, then make sure that you do a complete shaving. Okay, do not keep any beard or a mustache, because during the surgery that can be a problematic. So clean shave is usually advised. Again, after the surgery, you cannot be doing a shave very often, for at least for few days to few weeks. So clean shave is usually advised. So now you have reached in the hospital. What can you expect? So first of all, the hospital staff will ask you to stay in the preparation room. So once you go in the preparation room, they will give you a surgical gown or a hospital gown, and they'll ask you to remove all your clothes except the underwear. All your jewelry also has to be removed. So, and after that, the nurse will come and the nurse will put in a intravenous IV line. So this IV line is usually given over your arm. Now, if via this IV line, they will give you some medications, they will give you the test dose of the medicines, they will also give you certain antibiotics. So all the medications will be given to you by the nursing staff. One important thing is the motion or a bowel movement. See what happens after the surgery. We do not want you to strain for the bowel activity. So it is advisable that you pass your motion. And many times for that, you might be put on high fiber food items, or they might even give you some syrup which will help you evacuate your bowel. Sometimes if that does not work, then the enema can also be considered. Alright. Now, when you are going to reach to the hospital, okay, please don't forget to carry your medical file. Again, it is a very practical point, but patients make a mistake. Carry all your medications which you are taking pertaining to your overall health, whether they are related to thyroid or they are not related to thyroid. Any blood test, any kind of a testing which is done, carry everything along with you. When you go in the hospital, make sure you take a nice bath and a shower. Again, very important, though there are no restrictions after the surgery, but yes, a clean bath is advisable. If you have a hair and long hair, then make sure that you do a shampoo and clean your hair properly and tie your hair neatly. And if you are a gentleman, then in that case, make sure that you do a complete shaving. You have to shave your beard and a mustache. Because what happens, we are going to operate in your neck area, and if you have a hair, the operating surgeon might have a difficulty, and the shaving, temporary shaving can be done over there. So to avoid that, make sure that you do the shave completely at home only. Again, after the surgery, for few days to few weeks, you may not be able to do the shave. So to avoid all those practical points, you shave yourself clean and then you go. Make sure that you check your blood sugar, and that blood sugar has to be in the controlled range. Alright. So these are the certain practical points which you need to keep in mind. Alright. Now once you reach the hospital, initially the staff will put you into the preparation room. And when you go in the preparation room, they will ask you to remove all your valuable jewelries and all your clothes except the underwear. And they'll give you a hospital or a surgical gown which you need to be wearing that. Now the nursing staff will insert a intravenous or a IV line, and this is usually inserted over your elbow area. Through this IV line, your nurse will give you the important medications, the test dose of the medications, the antibiotics, the painkillers, and any kind of the IV fluids. All of that is administered by this IV line. In few patients, we might ask you to have a urinary catheter, so which is going to make it easy for you to pass the urine after the surgery. Sometimes if we find that the bowel is not passed, then the enema may be given even before the surgery. So this is the preparation in the preparation room. Again, in the preparation room, you will meet up with your operating surgeon who is going to actually perform the surgery. So if you have any of your question, doubts, or any apprehensions or any anxiety or a fear, you can talk to your surgeon about it, and he will be able to explain you everything in depth. Your operating surgeon might do a quick thyroid examination again to know about your particular case, and they might even undergo your entire medical case reading also. You will also meet up with an anesthetist doctor who will take a brief medical history and will explain you about the anesthesia. So if you have any questions pertaining to this, again you have a chance to talk to these surgeons and an anesthetist. Alright, once this entire procedure is done, you will be shifted into the operation theatre. Now you will be going on your own. You can walk and go, or else if you need an assistance, then they might take you in the wheelchair. So now when you are in the operation theatre, what will you find? So in the operation theatre, you will find couple of team members part of the surgery. So in that, we usually have an operating surgeon, operating surgeons, 1 or 2 assistant surgeon doctors might be there, the anesthetist will be there, the nurse will be there, and any kind of a ward boy or the hospital staff will be there inside the operation theatre. So these are the few people whom you will meet, right? Once you reach inside the operation theatre, they will ask you to lie down on the operating table. Okay, now so you are going to sleep in the supine position wherein your head will be facing the ceiling. Okay, just below your shoulder they might put any kind of a shoulder pad so that your neck area is clearly exposed. Now you will be put on a drape which is usually a green color so that your rest of the body part is not visible. Your both arms will be kept on the side table. The nurse and the operation theatre staff might put few monitors on your body. So these monitors are usually put on the chest area, which is going to monitor your heart rate and your breathing rate and your pulse rate. You will be also put a blood pressure cuff which is usually put over your arm, which will monitor your blood pressure. So these are the general setting of your body on the operation table. Now the anesthetist will come and will administer the anesthesia. See, this anesthesia is usually general anesthesia. However, there are few incidences where they use a regional anesthesia. However, general anesthesia is usually preferred. This general anesthesia is either given by your mouth by the gas form or into your blood vein. Okay, so when the anesthesia is given to you, you might find it little bit cold or a stingy kind of a sensation. Don't worry, after the anesthesia is administered, within a few fraction of a seconds to minutes, you will fall unconscious and you will not have any sensations. So when the operating surgeon will operate on you, you will not experience any kind of a pain, neither you will be alert and awake to see the surgery. Okay. Now once the anesthesia effect is set in, the operating surgeon will take a call and will operate on you. Once the general anesthesia effect is set in, your anesthetist doctor will also give you a breathing which will happen through a trachea. We call it as an endotracheal intubation. So this is also done for you to have a good breathing. Right. Once the anesthesia effect is set in, now will be the turn for the operating surgeon. So now the operating surgeon will operate on you. Now what kind of a surgery will be performed? Based on that, the duration of the surgery will last. See, understand that thyroid gland is a very small gland, okay, and the area around the neck is also very smaller area. Not only that, around your thyroid gland lies a very important structures like your nerves, then your trachea, your esophagus, your parathyroid gland. So your operating surgeon has to pay a lot of minute detailed focus, and because of that the surgery might be lengthy. Sometimes it can even go for 2 to 3 hours. Again, it depends on the extent of the surgery, that whether we are removing the entire thyroid gland or a part of the thyroid gland. It also depends what kind of a surgical procedure we are performing. So based on that, the time duration of the surgery varies. Now, the surgical procedures are also of a various type. In that, the very first surgical procedure, what we call it as a conventional thyroidectomy. Now, conventional thyroidectomy is an age-old procedure and it is one of the most common procedure. During the conventional thyroidectomy, your operating surgeon will take a smaller incision. Now, the size of the incision again varies whether we are going to remove your entire thyroid gland or a part of the gland. So, usually this incision lies around 1.5 to 3 inch. And once the incision is taken, this incision is usually planned to take along the crease of your skin so that later on when it heals, it does not leave the scar mark. So this incision is usually taken in the center of your neck area. And after the skin incision, the operating surgeon will separate out the muscles and now search for the thyroid gland and will do the surgery accordingly. And once the thyroid gland is removed, okay, the operating surgeon will again flip back to the muscles and the skin layer and tie up a sutures. Now the sutures are again of the two types, okay, either we have a conventional suture or nowadays what we have, the dissolvable sutures that can also be used. So if you are going to use a dissolvable suture, then gel tape or steri strips is usually used. Okay, so this is about the conventional thyroidectomy. If you have a thyroid cancer, then in that case your surgeon will also search for the lymph node, and those lymph node may also be removed. So again, that depends on the indication of the surgery. So this is the first conventional thyroidectomy. The second kind of a surgery, where we call it as a transoral thyroidectomy. Here what happens is that we do not take any incision on your neck area, and because of that, after the surgery no one will actually come to know that you have undergone a surgery. In this kind of a route, we usually take an incision via the oral cavity. So this is the transoral surgery. Third surgery is called as a robotic surgery. Here in the robotic surgery, again the incision is usually taken over the armpit and not over your neck area. And the fourth procedure is the endoscopic thyroidectomy. Here we are going to take a help of an endoscope. Endoscope is nothing but a special surgical instrument which has a camera attached to it. So your surgeon will take a very small incision and will pass on this endoscope, and via this camera which is connected to the computer, the operating surgeon will visualize the field in the computer and will operate. So these are the four different ways the surgery can be performed. So which is the right kind of a procedure for you? You can speak to your surgeon before undergoing the surgery, so you are mentally prepared for the outcome. Now that the surgery is complete, okay, but you are still in the unconscious state. So in this unconscious state, the nursing staff will shift you from the operation theatre to the observation room in a stretcher. In the observation room, the nursing staff will observe you and monitor you closely. They'll monitor you for your heart rate, your pulse rate, your breathing rate, the concentration of oxygen, your blood pressure, your blood sugar, everything is closely monitored. They'll also monitor whether the effect of the general anesthesia is vanishing off or not. And once all this close observation is complete and the anesthesia effect is gone and you regain your consciousness state, only after that you will be shifted from the observation room to your hospital regular room. Okay, and once you are shifted to the regular hospital room, you will be again kept under the monitoring and a close observation. Okay, now during the close observation period, you will be given lot of antibiotics and lot of pain medication. There will be analgesics who has a sedative effect will also be given. So you might not feel that kind of a pain. You also might feel sleepy and a little tired also. And during this hospital stay, we usually do not ask a patient to take a discharge. However, nowadays we do have a daycare procedure, but still it is always advisable that we take the patient in the hospital at least for a day or two. And during this time period, the nurse and the doctor will do a lot of close monitoring, especially first 24 hours where the risk of the complication is highest. And in that, the most common complication which can happen is a drop of your calcium level, and there can be a chances of the bleeding. Okay, so these are the important points. So after the surgery, you will notice that there is a huge kind of a dressing which is done. This dressing is usually the pressure gauge dressing, and in few patients from the incision scar, a small tube is passed, and at the end of the tube there is a small bulb which is attached, and this bulb will actually collect any kind of the bleeding or any kind of the fluid which gets secreted. So this is also very closely monitored during the first 24 hours. Okay, and if everything is perfectly fine in that kind of a situation, on the next day you can be discharged from the hospital. Okay, and once you will get discharged from the hospital, your nurse will explain you what all medications you have to take, how you have to take those medications, how you have to take care of your dressing, and when to come back for the follow-up. By the way, I have made a separate video on how to take care of yourself once you take a discharge from the hospital. So if you are planning to undergo a surgery, watch that video so you will have a detailed information. Also, what are the complications can happen after the surgery, that is also video is uploaded, you can watch that video also. And very importantly, a neck rehabilitation exercise. So this video is also available, you can watch all of these videos so that your outcome after the thyroid surgery is very good. Alright, I hope after watching this video you got some good useful information. You are now mentally prepared to undergo a surgery and what can actually happen inside the operation theatre. If you are new to my channel, please don't forget to subscribe so that you get a more and more health related information. And if you have any of your personal question whose answer you are seeking for, write in the comment box. And if you have undergone a thyroidectomy surgery, please write down what was your indication for the surgery and what kind of an issue did you face and how you tackled it. It might help someone who is planning to undergo the surgery. Right, we will meet again with some new good interesting topic. Till then, take care of yourself. Namaste.